Hello, everyone, residents of Wolfeboro. I am Schelley Rondeau. I am an RN town health officer, and I also work for Central New Hampshire VNA as the pediatric nurse coordinator. I've been the health officer for quite a few years now and been a nurse for over 34 years with lots of public health experience. So I am here today to talk to you about the coronavirus, also known as COVID-19, which everybody it's a talk about. This is a new virus which first presented in China in December 2019. It affects the upper respiratory tract and can cause severe health complications, including pneumonia. It appears to affect the older adults the worst, but can affect the younger crowds too, just as hard. The virus is spread by airborne saliva droplets or by touching something that has been contaminated. So if someone coughs and the saliva comes out from the cough, it can travel up to 6 feet. So the virus can live on various surfaces between 4 to 7 days. So the virus is killed best by good hand washing and cleaning the surfaces that may have been contaminated with warm water and soap and or Lysol or Clorox wipes. When cleaning the hard surfaces, you need to wipe them down and let them dry for 2 minutes before putting anything on top of it again. The best way to avoid getting sick in the town of Wolfeboro is through social distancing. What this means is staying at least 6 feet away from people. So this means if you have to go to the grocery store and you're standing in line, stand back. If you have to go to work, stay away from, move your seats, move chairs around so coworkers are not close by. Most businesses have technology nowadays, so using the technology by sending and receiving emails, by FaceTiming, by using Zoom, by using other applications as Skype or GoToMeetings to help prevent people gathering in a large room. As a health officer, I am monitoring this on a daily basis, probably more than 3 or 4 times a day, to see any changes in direction from the Department of Health and Human Services at the state. The best way to remain healthy during this crisis is to do the following. Go to and from work directly and avoid crowded places if possible. If you have to go, make sure you wash your hands prior to going in to a store and coming out. Wipe down the carts if you have to use them with Clorox wipes. Wash your hands and surfaces often using soap and water for at least 20 seconds, or the hand sanitizer that has to have at least 60% alcohol in it. Wash your clothing frequently. Cough into your elbow so you don't spread contaminants. Disinfect areas that you might have touched, like desks and cars and door handles. Carry Clorox wipes and wipe down common areas when you have to go out, like if you have to fill up fuel, wipe down the gas pump, or wipe down the pin pad, or put gloves on. You can use, rubber gloves at home to wash dishes. Avoid large venues. No more than 5 people should be a gathering. If you're sick for any reason, please stay home. Obviously, call your PCP or your doctor to find out what further matters he wants you to do, but you need to stay home. And you need to self-quarantine yourself if you've been exposed up to 14 days, because we know will help kill that virus.
Okay, hi, how are you? I'm Chief Dean Rondeau, and I'm the Chief of Police for the town of Wolfeboro. And so I'm going to be talking to you today about a few things that I think are really going to keep us all safe, and some things that we can all use, some strategies that we can all use to get through this. So the first I'm going to say is this is a very avoidable, preventable disease. It is really something that is being spread right now through the community, and we just need to take community precautions a little bit more seriously. But we can all get through this. The key to victory lies within our ability to blunt the spread of the virus. All right, that's just the bottom line. The good news is that most folks who will come down with this virus will show mild to moderate symptoms. Fortunately, about 5% of the population will suffer adverse effects. So what does this mean? It means that these people will need advanced supportive care. The problem becomes that the supportive care is labor and time intensive and requires long periods of time to really take hold, sometimes even weeks. The virus hits fast and hard, and sometimes the symptoms showing within 1 to 2 days and lasting up to 6 weeks in some cases, though the average is about 2 weeks. Still, attending to those number of people requires a lot of workers and resources, which in a pandemic may not be readily available, right? That's the issue. The issue is we're resource constrained. Suffice it to say that 5% of the population of Wolfeboro is about 310 folks. This number far exceeds the capacity for most hospitals and is difficult to manage. So now maybe some people will see the dangers associated with this virus. Sure, I see this all the time. Folks are saying, well, this is really no worse than the flu, or maybe it's a little bit worse than the flu. What's the big deal? The mortality rate is relatively low. Well, right, sure, except that 5% of the population, right, and it may not sound like a large number to you, but it is a large number. All right, so 5% of our population is going to far exceed the capacities of the area hospitals, right? I mean, it's just the bottom line. So therein lies the danger, okay? It's not that the mortality rate on this is 50%. We're not saying that. We're saying this is going to make people really, really ill, and they're going to need some advanced care to help them get through. So that's the reason why. That's the issue, okay? So even though most of the effects seem most of the folks that have this virus, it may seem like they have the flu. Others may not be so lucky. And the sheer numbers of patients seeking treatment can very easily overwhelm hospital emergency capacities. So this is a real problem right now. This is exactly what we're seeing in Italy. Italy simply just waited too long to act. The best way to beat this pandemic is not to get sick. So let's talk about self-quarantine and shelter in place, and what does that look like? So as your chief of police right now, what I'm asking you to do for the citizens of Wolfeboro is just what my wife said. Go to work. If your business is still engaged in work, that's fine. Go to work. Try not to socialize. Come directly home. Just go to work, come home. That's what you've got to do. You're going to avoid large gatherings. You're going to avoid large venues of people. That's what you want to do. You want to avoid large groups because that's how this virus really, that's how it feeds, right? It feeds off us. So think of it like this. If this helps you, there's two things here that I think are really good. First of all, think of it as the fact that you are contaminated, right? You are contaminated, and you don't want to give it to your loved one, right? So you are going to say, okay, I'm contaminated. I'm going to avoid contact with people. I don't want to make anybody else sick. That is a method. That's a good technique. The other way, if this helps you, think about why we want to social distance, why we want to shut down the bars and the movie theaters and all this little stuff, and why we can't go to parks and play on the rides. And so here's here it is, right? Think of you as a food source, right? The virus is a predator. It needs you to survive, right? It gets into you, right? It infects you, and then you go around and you touch surfaces or touch other people, and then someone else picks up that virus from a surface, and the virus continues to spread. If we social distance, if we go to and from our place of employment and home, and we essentially self-quarantine, right, for a couple of weeks, which isn't really that hard to do, then the virus can't feed readily. And eventually your body's going to build up antibodies, and the virus is going to work its course, and your body's going to fight it off, and it's essentially going to die. And without another food source, if you will, for lack of a better term, it's essentially just going to burn itself out, which is what we want. That's the purpose to social distancing. Right now, we're inconvenienced, right, with sometimes lack of supplies, and we're inconvenienced because the bars and the movie theaters are shut down, and our social venues are shut down, and concerts and basketball games are shut down. If we want this shutdown to be a few weeks as possible, as short of duration as possible, then we're going to social distance. If you want this to continue on for a long period of time, and you want to be dealing with this for 18 months or more, then forget everything I'm saying, right? Because it isn't going to make any difference. All right, so forget everything I'm saying, and it will continue. Okay, so we have the power, right? We have the ability to make this thing happen. So as your chief of police, I'm asking you to exercise some common sense, right? A little self-sacrifice here. If you're an introvert, this is your day. If you're an introvert, this is what you've been living for your entire life, right? You don't have to see anybody. You can shut in. You've been preparing for this your entire life. If you're an extrovert like me, it's really hard. But if you're an introvert, this is it. You can save the world right from your couch. All right, you never have to move from watching the TV. All right, so if you're, I'm asking all the introverts, step up to the plate. Let's do it. Let's hit a home run. All you got to do is stay home and do nothing. Okay, and that's really all it's going to take. Just stay home. Okay, if you're in essential services like we are, we have to come to work, right? And when we have to do things like I got to run a PD, and my wife has got to run the town's health department and see patients and so forth and so on. So, but do all the right things. Now, look, we're in the public every day, right? And we're not afraid because we understand the science behind this. We're washing and sanitizing our hands. We're washing our clothes. We're sanitizing our clothes. We're cleaning our surfaces. And we're fine. We're absolutely fine. So if you follow common sense practices, best practices, you're going to get through this, all right? And then we'll be laughing about this in 6 months, and everybody will be fine, all right? But we can get through this. So let's take now a look at what a shelter-in-place order means should one come down, just because I'm getting a lot of questions about that. Hey, Chief, what does this really mean? So first and foremost, a shelter-in-place order is essentially a defensive measure order that is issued when community leaders feel as though the virus outbreak is expanding beyond reasonable means of control. Okay, that's all it is. All right, and it's nothing to be afraid of. It is nothing to be afraid of. It's meant for your safety as well as ours. Okay, when ordered, it requires residents to remain in place at their homes except for essential activities, essential business, and essential government functions. All right, so let's talk about that. Essential activities. It doesn't mean you're shut down in your house for 2 weeks. That's not what it means. It means basically, look, shelter in place. You can go get your medicines to the pharmacies. They're going to be open. You can go get gasoline. That's an essential service. So the gas stations are going to be open. You can go get groceries from the grocery stores. They're going to be open. Yeah, the post office is going to be open so you can mail things. Basically, what you're going to do is you're going to do your business and you're going to go right home. All right. If you're in a non-essential government business, say like you own a bar, all right, or you own a restaurant, well, yeah, you may not be open, or you may be open for limited hours, or you may only be open to do takeout, things like that, okay? If you have an absolutely unessential business, let's say you're into, you're a movie producer, well, you may not be going to work. You may not be making any movies for a couple of weeks, okay? That's what a shelter-in-place is. So that's really what it means. I know there's been some confusion about what does this order really mean? Isn't this something we issue during school shootings and so forth? Well, yeah, it is kind of, but in this particular case, people understand what the term means and they know they need to stay home, except when they're doing those essential tasks. All right. So let's talk a little bit more about that. Right. Tasks essential to maintain health and safety, such as ordering medicines or seeing a doctor. Right. That's permitted. Okay, getting necessary services or supplies for themselves and or their family or household members, such as getting food and supplies, pet supplies, and things like that, that's permitted. Okay, engaging in outdoor activities such as walking, hiking, or running, provided that they maintain at least 6 feet of social distancing, that's permitted. Okay, so you can do that. So you see, it's not that bad, right? It's really not that bad. Caring for a family member in another household, that's permitted. Caring for elderly, minors, dependents, people with disabilities, or other vulnerable persons, all permitted. The shelter-in-place order would not apply to those who are going to work in essential businesses or essential government functions, which includes healthcare operations, including home health workers. All right, Essential service infrastructure includes construction of housing and operation of public transportation and utilities. Okay, so read here, your electric station and all the electric workers, they're still going to be out providing electricity and those things that keep society running. Grocery stores, farmers markets, food banks, and convenience stores, they'll all still be open. Pharmacies, healthcare supply stores, and healthcare facilities, they'll all be open. Gas stations, banks will be open. The garbage collection will continue. Okay, so it's really not. It's not as bad as it sounds. It's just limiting the activity. So things to do when executing any shelter-in-place order, right? Here you go, right? None of these are bad, right? They're all actually pretty wholesome activities, right? Help children understand why this is important, all right? They're probably going to be a little unnerved by this. You need to explain to them what's going on. Listen, this is not the first time we've dealt with this. 1918, 1919, okay? My grandmother lived through the Spanish influenza, all right? It was a very scary period of time. She was a little girl. She told us about it. I learned about it, and I was interested by it. I'm very familiar with what they had to do and how they got through, all right? So explain to your children what's going on, okay? They'll understand. Help your children with their homework and schoolwork assignments. Spend family time together and renew bonds. I mean, after all, this is why we have families. Just the other day, I was sitting on the couch and I realized I was married.
Funny.
Get those pesky home repair items and lawn care items done around the home, okay? This is a great opportunity to do that. Call parents and grandparents and have family discussions. Get caught up on your reading. It's a great way to pass the time and exercise the mind. May I suggest you start with the classics? Clean your home thoroughly, use sanitizing wipes, and pay close attention to bathrooms and other common areas. Clean your vehicles in those common areas. Stay hydrated. All right, stay hydrated. That's key. That's really key to victory here. Stay hydrated, get healthy, and remain so. Okay, keep a diary. This event is historic. We're at some point, your children or grandchildren are going to want to know how you managed to get through the crisis, and give them your notes. Be honest and open. Remember, what you write down in your family, in your diary, what you're passing on through your oral and written history may help family members get through similar situations sometime in the future. Much like when I was a little boy asking my grandmother how did they cope and how did they get through the great Spanish influenza of 1818, 1819. Okay? Things not to do. Okay? Stop hoarding. All right? You heard me say the grocery stores are going to be open. Our supply trains are intact. Our road network is intact. All right? It's still there. I was out on it this morning. It hasn't gone anywhere. All right? You don't need to hoard supplies. All right? The grocery stores are going to stay open. You're not going to be shut up in your house. So stop doing that. You don't need a lifetime supply of toilet paper. All right? For example, we were just down at the Hannafids the other day, and they're cleaned out. Okay? Stop doing that. Because one, perishable foods, yeah, they're going to perishable foods are just that, they perish. All right, so you either eat them or they go bad. You can't freeze a lot of this stuff. Okay, sure, bulk goods like toilet paper, you can probably corner the market and have enough toilet paper for the next 50 years, but it seems a little counterproductive. Okay, plus hoarding is really hugely expensive. You don't need to do that. And while I'm on hugely expensive, let's talk about the banks are going to stay open. The electricity is there. They have access to the internet. That hasn't gone away. You can do banking. Okay, you can do banking over the internet. You can do it in person. You can go there. Stop taking your money out of the banks. The banks are going to be there. They're just fine. Your money's fine where it is, and you don't need to be shutting down your IRAs. We're going to be through this here probably in 2.5, 3 weeks. Okay, we're going to be through this. Okay, your debit cards will work just fine. Okay, so you don't need to close out your IRAs or cancel out your retirement savings and take it all out in cash. That's just that really is, that's not very bright. Don't do that. Okay, you're really not going to need to. And there's the banks are fine. There's nothing wrong with the banks. Stock market, sure. I know the stocks are taking a beating right now, and that goes without saying. I invest in the stocks. I have stocks. I'm keeping my eye on them. I haven't taken any of my money out. Have I lost value? Yes, I've lost a little bit of value. I haven't lost an incredible amount of wealth. Okay, the stocks are going to be coming back up. When they do come back up, I want to be in a position to take advantage of that. All right, and make all that money up. All right, so this is an opportunity, and that's the way you need to look at it relative to the stock market. So I would be cautious about what you do with your life savings if you've invested heavily in the stocks. Certainly discuss these matters with a trusted confidant, more importantly, your financial advisor, right? Hopefully at a point in time in your life where you may be looking for retirement, you should be seeking advice from a financial advisor. Go ahead and do that. We have plenty of them in town. We have plenty of them in national brands. Edward Jones, whom I use, they're very good, right? They'll give you great advice. So follow their advice. Heed their advice, follow their advice, take advantage of it. Stop non-essential gatherings. Look, this is a tough one, right? I know sometimes people plan weddings, for example, bar mitzvahs, functions like confirmations, okay? These are very important religious, family, social functions that need to occur, right? I understand that. But maybe we should postpone these, and that's all I'm saying, right? Maybe we should look at postponing those until we get through this, okay? But non-essential gatherings should really be curtailed, postponed. If you're planning a trip to Florida, for example, first of all, nothing is open down there. There's no bars open. There's no restaurants open. You're going to have difficulty getting food. There's a lot of hotels and motel chains are not open right now. So this may not be a good time to be going to the beach. Okay, that's all I'm going to say. You need to think about that. Those are personal decisions. I wouldn't be traveling during a global pandemic. Okay, this is a global pandemic. All right, it's just not in New Hampshire. It's in the whole United States. It's all over the world. Don't travel. To and from home, right? To and from home. That's all you got to do. Okay, I get a lot of questions about this one, martial law. Okay, so first of all, let me explain what martial law is and let me explain what it isn't. When the governor calls up the National Guard to assist civilian authorities, right? I am a civilian authority, right? When they call up the National Guard to assist civilian authorities, all right, that is not martial law. Right, that is not martial law. That is the governor exercising what is called Title 23 authorities to call the National Guard forward to do things. Usually support to law enforcement, support to medical, support to hospitals, support to community leaders, right? It's a resource. If we remember the ice storm of '98, the governor called up the National Guard to help us clear roads, to help the public works departments clear roads and run machinery and equipment to move debris and trees and ice and snow from the roadways and so forth and so on. It's exactly what that was, right? It wasn't martial law. He was just calling up the National Guard because they have big machines and they have bigger plows and they have lots of bodies, lots of labor, and the state pays for that, right? Those are state employees at that particular point in time. He's paying for that. All right, that's what that is, right? So the governor in New York, right, called out the National Guard to help quarantine New La Rochelle, okay, to kind of keep that virus contained there, okay? That's not martial law. That's not what that is. That is the National Guard support to civilian authorities, all right? Martial law happens most recently, and a good example, and I was part of it when I was in the service, was in Louisiana, right after Hurricane Wilma, Katrina came through, and the civilian government collapsed, right? There was no law enforcement, right? They needed the military to come in and help restore order, to do law enforcement, to do fire protection, to do rescue operations. Lieutenant General Honore was put in command he was the military commander for that department within Louisiana. And once the military restored civilian order, it was turned back over to civilian authorities. Okay, so that's what martial law is. We are a long way out from martial law. This is not even, I don't know why people think that this is going to happen, but that's not, we're not even close. All right, we have a functioning civilian government. We have, yeah, everything is still in order, everything is still intact, nothing has gone away. And no, the President of the United States is not going to declare martial law in the United States, okay? It just isn't going to happen. We're not even close to that at this point. There is no reason for that to even occur. Is this a serious incident or a serious situation? Sure. Okay, are we going to get through this? Yes, we will. There's not going to be anything to worry about. We just have to take some basic precautions. The biggest thing here, folks, is that we've been inconvenienced, all right? Everything that's happening to us is just a huge inconvenience. We're going to get through it. It's easy. This is easy. All right, we just need to cooperate. We need to check in on our neighbors and our family and our friends. And we need to limit our travel to and from. We need to stop treating this like this is an everyday incident and life is going to go on like it did 3 months ago when we weren't dealing with this. Well, no, times have changed a little. We have to be a little bit more savvy in what we're doing, okay? So that's the situation here. And these are good tips to pass on. And just be, let common sense prevail as to what you're going to do. But no one is coming for your guns. No one's coming for your guns. Your guns are fine. No one's taking your guns. Martial law is going to be declared. This is not part of any big government conspiracy, because I see that a lot too out there. The banks are fine. The financial infrastructure in the United States is still functioning. So we'll all get through this together. The important thing is to follow these steps and self-quarantine for the next few weeks, and before you know it, you're going to be heading back to work, and this will all be just a bad dream. But in the meantime, as I discussed before, the social distancing and the sheltering in place or the self-quarantining is really not all that bad, and we can get through this. So thank you very much. We certainly need everybody's cooperation. As your chief of police, I'm asking you to follow the steps that have been laid out by our town's health officer, and to do the simple steps that I have suggested, and we'll all be just fine. Thank you.